again, so goals, the way that Dr. Borisov and I practiced, we want to figure out how to keep more stuff in-house. A lot of this stuff, the design aspect, you can outsource each component of this, but the more you can learn to keep in-house, costs go down and control goes up. So that's one of our goals, is how do we utilize software. I like to keep overhead in mind and all this stuff. So I'm not going to come out here and say, hey, everybody needs to go purchase a $10,000 ExoCAD software, and a $3,000 laptop, and you're going to need to buy all this fancy, expensive stuff. It's like, how can we do this, at that high 1% level, but with overhead in mind and keeping costs down. So a lot of this software is free. A lot of the materials that we're using are like low cost, especially in the temporary situation. So I mentioned this before, and I said this before, but it increases doctor time. You guys have seen that. Those of you guys that have designed guides and you're designing temporaries, it's like, you're sitting there late at night, clicking, re-clicking. It's a lot of time. But it really is like riding a bike. You do it once, and then the second time it's half the time, and the third time it's half the time of that, and it gets exponentially faster. I remember the first full arch case, that we were both planning, and it was just hours, right? You're just sitting there like hours,
17 hours.
Yeah, lots of hours, right? And then so we've learned to really distill that down. Okay, how can we cut out processes? How can we make things faster? How do we minimize redundancy? And now we're able to plan these cases just in between patients, right? So like at work, not after hours, just in between patients. You schedule the patient a couple weeks out maybe, and you just take time between patients, and you sit at your computer and you do a little bit at a time. And it does get faster and faster, but you got to practice. You got to just get in there, put in the hours, and just expect the time to speed up. So start small and repeat.